Good evening, everyone. I welcome you once again in Pharmaceutical Managers Grade. In this channel, we discuss about lot of key responsibilities, key functional area, and how a manager can develop themselves in pharma industry. In last episode, we talked about key role and responsibilities of area business manager. If you have not seen the last video, you can go to this particular channel and you can browse. But इस वीडियो में, इस एपिसोड में, we are going to discuss two important soft responsibilities of area business manager. ना आप लोगों को पता है कोई भी responsibilities, कोई भी रोल में there are two aspect. एक है official, दूसरा है unofficial, which is not been written anywhere. वो कहीं पे लिखा नहीं होता है. But that plays a very important pivotal role in your career journey. So इस एपिसोड में हम लोग डिस्कस करने वाले हैं वही दो सॉफ्ट स्किल्स की और यू कैन से दो सॉफ्ट रिस्पॉन्सिबिलिटीज की जो कि एक एरिया मैनेजर को अपने करियर में और ज़्यादा स्ट्रेंथन बनाएगा. सो व्हाट आर ऑल दिस टू सॉफ्ट रिस्पॉन्सिबिलिटीज? आई टेल number one is learning from customer and number second is psychological safety. So first, what was that? Learning from customer. The first question is, who is our customer? Obviously, doctors are our customer, external customers. So doctors are our customer. Now if I ask you one particular question, define a successful doctor. How will you define that? Obviously, that's most easiest. A successful doctor can be defined one who can actually transform the layman language into a scientific diagnosis, defining a particular disease out of that and prescribing proper molecule or you can say brand name so that a patient can take those molecule or brands and get rid of the disease. So that kind of doctors can be defined as a successful doctor. Now in this whole process, one thing is very critical. The first one, जो मैंने बोला था कि एक लेमैन लैंग्वेज को कैसे आप ट्रांसफॉर्म कर सकते हो एक साइंटिफिक डिजीज नेम पे. नाउ लेट मी गिव यू एन एग्जांपल. सपोज वन पेशेंट कम्स टू ए डॉक्टर. व्हाट डज ही और सी सेज? डॉक्टर साहब मेरा पेट दर्द कर रहा है. डॉक्टर साहब मेरा छाती पे एक अकड़न जैसा आ रहा है. डॉक्टर साहब मेरा सर दर्द कर रहा है. डॉक्टर साहब मुझे 3 दिन से भूख नहीं लग रहा है. डॉक्टर साहब मेरा आई एम हैविंग सम लूज मोशन. सो इसका मतलब है एक लेमैन आके, एक नॉर्मल सा इंसान आके डॉक्टर्स को कभी ये नहीं बोलता है कि डॉक्टर साहब मुझे टॉन्सिलाइटिस हुआ है. डॉक्टर साहब मुझे आई फील आई एम सफरिंग फ्रॉम मलेरिया और एनीथिंग. दे डोंट से दैट. दे से ऑल द नॉर्मल लेमैन लैंग्वेज, एक कॉमन लैंग्वेज में बात करते हैं डॉक्टर से एंड जो भी सिम्टम्स उन लोगों को आता है दैट दे से टू ए डॉक्टर. नाउ व्हाट ए डॉक्टर डू? डॉक्टर ऑलवेज प्रोब. अच्छा उसके बाद क्या हुआ, कब से हुआ, खाने में क्या तकलीफ है, एंड ऑल दिस थिंग डॉक्टर आस्क्स. डॉक्टर एक्चुअली प्रोब एंड आफ्टर प्रोबिंग फॉर यू से 5 minutes, 6 minutes, 10 minutes based on the experience of the doctor, they define those, they link those symptoms with one particular disease and after that they name that disease and to treat that particular disease whatever molecules or brands are required they write it down on the prescription and they tell patient ये दवाई आपको 10 दिन तक लेना है. 10 दिन के बाद आपको मेरे से मिलना है फॉलोअप के लिए. मैं चेक करूंगा आपका इम्प्रूवमेंट क्या है. आफ्टर दैट I may reduce the strength of this particular medicine, or I may increase it, or I may stop it. Or sometimes doctors say ये 7 दिन का दवाई मैं आपको लिख के दे रहा हूँ, 7 दिन बाद आप ठीक हो जाओगे एंड उसके बाद आपको आने की कोई जरूरत नहीं है. So that is the whole process a doctor do. But we have seen there are a lot of doctors who cannot transform this particular normal layman language into a proper, defined and specific scientific disease. Suppose कोई पेशेंट आके बोल रहा है, डॉक्टर साहब मेरा छाती पे ऐसे जकड़न आ रहा है, मुझे चेस्ट पेन टाइप का हो रहा है. Now that may cause due to many reasons. That may be due to asthma, that may be due to COPD, that may be due to some kind of cardiac problem, anything. So एक normal layman language को डॉक्टर अगर ट्रांसफॉर्म ठीक से नहीं कर पाया, then maybe that patient is suffering from a cardiac problem and डॉक्टर उसको अस्थमा के मेडिसिन लिख रहा है. Do you think the patient will get cured? Never ever. So ठीक करने के लिए फर्स्ट स्टेप इज दैट डॉक्टर को उस नॉर्मल लेमन लैंग्वेज को समझ के एक स्पेसिफिक एग्जैक्ट डिजीज तक पहुंचना है. उसके बाद उस डिजीज को ठीक करने के लिए प्रिस्क्रिप्शन या मेडिसिन रेकमेंड करना है. तभी जाके वो पेशेंट क्योर होगा एंड द डॉक्टर्स विल गेट फेमस. देयर विल बी लॉट ऑफ पेशेंट्स विल बी कमिंग टू दैट डॉक्टर. Now why I am telling this to you? You are area business manager in a pharma company. Why you need to know all these things? But let me tell you, this is very quite similar. The doctors, whatever he or she does and whatever the area manager does in the particular field, it is very quite similar. Now put yourself into the doctor's shoe. आप खुद को डॉक्टर की जगह रखो. तो फर्स्ट स्टेप इज व्हाट? एक पेशेंट आता है डॉक्टर के पास, नॉर्मल लेमन लैंग्वेज पे अपना सिम्टम्स बताते हैं, क्या क्या प्रॉब्लम उनको होता है. इन द सिमिलर फैशन आप जब हर दिन फील्ड वर्किंग के लिए निकलते हो, आपके जो मेडिकल रिप्रेजेंटेटिव रहते हैं और या टेरिटरी मैनेजर्स रहते हैं, आपको आके दे से लॉट ऑफ प्रॉब्लम्स, दे गिव लॉट ऑफ इनसाइट्स. सर that particular doctor is not prescribing my medicine. Sir, that particular chemist is not making medicine available. That particular stockist is not giving me order, and so on and so forth. So all this information this territory managers or medical representative gives you. So you remember, जब एक पेशेंट आता है डॉक्टर के पास क्या बोलता है? लेमन लैंग्वेज. So all this layman language a territory manager uses in front of you. आपको क्या करना है? डॉक्टर क्या करते हैं उसके बाद? डॉक्टर ट्रांसफॉर्म ऑल दिस लेमन लैंग्वेज इनटू ए स्पेसिफिक डिजीज. सिमिलरली whatever information that you are receiving in the field from your team, from the external you can say the stakeholders, आपको क्या करना है? इसी लेमन लैंग्वेज को जो भी इंफॉर्मेशन आपको मिलता है, इसको एक स्पेसिफिक डिफाइन करना है आपको एक स्पेसिफिक प्रॉब्लम्स के ऊपर कि व्हाट इज द रूट कॉज, व्हाट इज द एग्जैक्ट प्रॉब्लम एक्चुअली दिस पर्टिकुलर पर्सन इज फेसिंग. यही आपका काम है. नाउ दिस माइट साउंड वेरी इजी कि ये तो बहुत इजी काम है, ये तो मैं हर दिन करता हूं, बट एक्चुअली नो. You remember I told that some patient might be complaining chest pain, and instead of writing you can say a cardiac medicine, hypertension medicine or anything something like that, if a doctor gives him prescription for asthma, will the patient get cured? No. And ये डॉक्टर कैसे करते हैं? प्रोब कर करके. और क्या हो रहा है आपको बताओ, कितना दिन से हो रहा है आपको बताओ, क्या क्या तकलीफ है आपको बताइए, आपका फैमिली हिस्ट्री बताइए. लॉट ऑफ थिंग्स, लॉट ऑफ इंफॉर्मेशन ही ट्राइज टू गैदर. ही और ए डॉक्टर कभी डायरेक्टली कंक्लूजन पे जंप नहीं करता है. ऑब्वियसली आई एम टॉकिंग अबाउट सक्सेसफुल डॉक्टर्स, नॉट दोज हु आर अनसक्सेसफुल. सिमिलरली एज ए एरिया मैनेजर मैंने आपको बोला कि जब भी आपके पास दीज आर इंफॉर्मेशन आर कमिंग, प्रॉब्लमेटिक इंफॉर्मेशन, कि you have to do what? You have to collect all those information from various stakeholders. After that, you need to probe to your teammates, to the external stakeholders, stockist, chemist, and there are many persons. You need to probe and you need to define one specific exact problem. This problem identification will solve your 80% problems that you are having. आप इसको अगर आइडेंटिफाई कर लिए 80% प्रॉब्लम का हल आपके हाथ में है. After that, what you need to do? Once again, going back to the doctor, what he does? He writes prescription. तो आपको क्या करना है? तो once you have defined the exact defined issue, आपको उस particular issue का solution देना है आपके teammates को. In a written format you can give. कि Mr. X, you have to do this, this and this. Now once again I'll bring one more analogy. देखना कभी भी एक जीपी डॉक्टर जनरल प्रैक्टिशनर्स अपने प्रिस्क्रिप्शंस पे फर्स्ट पेज, सेकंड पेज, एवरीवेयर दे राइट मेडिसिन. बट इफ यू गो टू अ स्पेशलिस्ट they will write only 4-5 medicine, that's all. Similarly, आप जब अपने टीममेट्स को सॉल्यूशन प्रोवाइड कर रहे हो, that should not be 1 2 3 4 5 6 7 8 9 10 to 20, not like that. It has to be very specific. 1 2 3, maximum 4, maximum 4. So आपको अपने टीममेट को बताना है कि देख, see, this is the only problem that you are having. It is the exact problem you are having and you need to do this 1 2 3, this particular thing. Once again going back to the doctor. After that डॉक्टर क्या बोलते हैं पेशेंट को कि आपको ये मेडिसिन 10 दिन तक लेना है and after that you need to come back to me to see that whether your disease is getting cured or not, or it require some kind of reorientation or redirection. Similarly, जो भी solution आप अपने टीममेट को प्रोवाइड कर रहे हो, that has to be very much time specific. It should not be for 30 days, you come after 30 days, 40 days, 2 months, not like that. You give them a timeline. Okay, these are the solutions that you need to try and you need to report progress after 7 days or 3 days or 4 days, whatever timeline that you think feasible. And after that, what a doctor do? Suppose the patient comes back after 10 days, they see that what is the progress, how much, what is the patient is getting cured or not. Similarly, आपको भी देखना है कि आपके दिए गए हुए solutions को implement करने के बाद whether the things are getting progress or not. And if you see the progress is really good, you need to tell them what? To continue. And if it is not, then you need to reorient, redirect those actions which you think that will fetch result. So if I want to conclude the first soft responsibility of area business manager, I will conclude like this. Number 1, you have to collect all the information from the field, from different stakeholders, from your team, from doctor, from patient, from chemist, from stockist. All this information will come to you as a layman terms, normal layman terms it will come. Second thing what you need to do, you need to convert all this layman language or layman information into a particular specific problem. You have to define all this, you have through all this information, you have to define a particular issue. Number 3, what you need to do, after defining the particular issue, you have to give a specific solution to this particular issue. Number 4, you have to define specific timeline, that within how much time you will see that things are getting progressed or not. And last, once you see the things are really getting changed, it is getting progressed, you have to continue or you have to redirect or reorient whatever the solutions you have proposed to the team. Now let us go to the second most important soft responsibility of area business manager. That is, I call psychological safety, or you can say providing psychological safety in your team. So let us explore what is this all about. So क्या है ये psychological safety, और in Hindi you can say मानसिक सुरक्षा. So remember, I'm not talking about any kind of monetary safety, I'm not talking about any kind of physical safety, but here I'm talking about most important part of your soft responsibility is providing your team psychological safety or मानसिक सुरक्षा. Now what it is? It means that any team member will feel safe under your leadership. Now safe का मतलब ये नहीं है कि he will be very much relaxed, he will be always getting praised. आप उसके लिए हर वक्त अच्छा बोलते रहोगे, उसको बहुत इंसेंटिव मिल रहा है या मिलेगा, आप उसको कमिटमेंट कर रहे हो कि उसको प्रमोशन मिलेगा. So all these things are not psychological safety. These are all very negligible, materialistic, or you can say a carrot and stick model में जिसको रिवार्ड बोलते हैं, उस टाइप का रिवार्ड पर प्रोवाइड कर रहे हो टीम के अंदर. एंड ये बहुत शॉर्ट टर्म होता है ये सब. ऑल दिस कमिटमेंट ऑफ प्रमोशन, इंसेंटिव, गिविंग सम काइंड ऑफ गिफ्ट्स. चलो इसने अच्छा सेल किया, उसको एक शर्ट मिल गया, उसको एक अमेजोन का वाउचर मिल गया, उसका एक फैमिली का डिनर करवा दिया और लंच करवा दिया. ऑल दिस थिंग्स आर वेरी शॉर्ट टर्म. सो ये सब कुछ साइकोलॉजिकल सेफ्टी में नहीं आता है. हालांकि ये सब कुछ में भी नहीं आता है. वी समटाइम think all these things will provide motivation to the team. No, these all things are not actually increase the motivational factor in the team. ये बहुत ही शॉर्ट टर्म एक पॉजिटिव फीलिंग्स क्रिएट करता जरूर है. इफ यू आर गिविंग समबडी ए रिवॉर्ड, सपोर्ट अच्छे सेल के लिए, टारगेट अचीवमेंट के लिए आपने अपने टीममेट्स को एक शर्ट गिफ्ट किया, तो ये बहुत ही शॉर्ट टर्म एक पॉजिटिव मेंटल एटीट्यूड क्रिएट करता है. बट ये शॉर्ट टर्म एटीट्यूड कभी भी लॉन्ग टर्म मोटिवेशन क्रिएट नहीं कर पाएगा. सो दैट विल बी फेल्ड. सो देन व्हाट इज साइकोलॉजिकल सेफ्टी और मानसिक सुरक्षा? साइकोलॉजिकल सेफ्टी का मतलब होता है कि आपके टीम मेंबर निडर होके आपसे सवाल कर सकते हैं. दे कैन आस्क यू एनी क्वेश्चन विदाउट एनी फियर ऑफ रिप्राइमेंट. दे विल नॉट थिंक ऑफ कि अगर मैंने ये सजेशन आपको मेरे एरिया मैनेजर को दिया और मैंने अगर ये गलती और एनी काइंड ऑफ फीडबैक इफ आई गिव टू माय एरिया मैनेजर, दे विल नॉट कम टू मी विथ सम काइंड ऑफ punishment, but rather my manager will listen to me properly. He or she will try to understand me. वो सुनेंगे पहले. So that is number one point of psychological safety. The second point of psychological safety means that the mutual trust among team member. Your team is trusting you, and similarly you are also trusting your team. So once this trust quotient build up in a particular team, that means that team member or in that particular team, psychological safety is immense. Number third, without bias decision. तो जब भी इस टीम में ये कल्चर बन जाता है कि अगर इस टीम में कोई भी डिसीजन लिया जाएगा, सो वी विल बी ऑलवेज ए पार्ट ऑफ दैट पर्टिकुलर डिसीजन. ऐसा कभी नहीं होगा कि मैनेजर खुद सोच लेगा एंड ही और शी विल कम टू अस एंड विल गिव अस इंस्ट्रक्शन, ऑर्डर, आपको ये करना है, आपको वो करना है, आपको ये नहीं करना है, आपको वो नहीं करना है. All these things will not be a part of it, but rather my manager will come to us and we'll have a discussion on the particular issue, discussion on the particular solution, and then we'll take a decision not based on bias but based on the facts. That is called psychological safety. So once in a particular team, a team member can ask any question to his or her boss or manager, if a trust quotient in the particular team is high enough, and third, in a team any kind of decision is been taken without any kind of biased facts or figures, but based on actual facts and figures, that means that team's psychological safety quotient is huge, or psychological safety score is very high. This is one of the most key important factor, or I can say rather your soft responsibility as a area manager which you need to maintain. Now ये सुनने में बहुत इजी है, साइकोलॉजिकल सेफ्टी, मानसिक सुरक्षा, and also many people will feel these are all things bogus. I know what to do. I know better than anyone. I have been a medical rep for 5 years, 6 years, 8 years, and after that I got promotion. So I know what is wrong, what is right. Any manager who thinks like this, that I know the solution, I can tell without any doubt that career development of these sort of people will be restricted soon enough. Because time is changing very fast. We are not at all working with the same kind of old mentality people. Right now we are working with generation Z, you can say. It is not that this young generation who are all joining pharma industry as a medical rep are typical and having the old thought process. They are very young, they are very energetic, they are very positive, they belong from a very good family, they are well educated, their communication skill is very high, they are very matured, and they are having very high aspiration. And this generation Z is actually demand respect, and respect not based on your seniority, not based on your age group, but respect for each other, for whatever they are. That kind of respect they demand. So as an area manager, if you want to have this sort of young, energetic, smart people in your team, if you want that your team should be very productive and energetic, then you have to unlearn many things which you have learned throughout last couple of years. And these two soft responsibilities, learning from your customers, I have already given you the analogy of doctor and how a doctor can be very famous, or you can say successful doctor. And second is that psychological safety or manasik suraksha building in your team. I hope this video has already given you enough pointers to ponder over, to think upon. So please chew on these particular facts, think over it, and have your action plan ready. So if you like this video, please comment below with your questions. I'll be very happy to answer those questions. And I have seen a lot of people are not subscribing this particular channel. Please do subscribe so that I can upload many you can say managerial development pointers, so that you can have you can have a look on those pointers, you can think, and you can progress in your career. Thank you very much for watching. We'll meet soon with the next episode.